Welcome, everyone. My name is Corinne, and I will be your moderator this evening. I am excited to welcome Dr. Kyle Bogan as our speaker tonight, as he will discuss custom implant solutions. Before we get started, I would like to take a moment to go over some housekeeping. If you have a question, please type it into the box labeled "Have a Question" on your console, and we will answer them live at the end. At the end of the webinar, there will be a live demo experience with Michael Purcell, a fast track advisor with Henry Schein. So if you are interested, please stay until the end. If you would like to book a custom demo or request a quote, please click on the Schedule Today widget on the right side of your screen anytime throughout the webinar. This webinar is sponsored by Dentsply Sirona, and Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. Dr. Bogan, welcome, and thank you for being with us tonight. I'll pass on over to you.
All right, thanks for having me. So tonight we're going to talk about custom implant solutions, and specifically I'm going to spend time discussing the workflow options that are available with the Dentsply Sirona equipment that I use in my practice, and how that kind of impacts the workflow, the options that it gives us to do things in-house and also with our laboratory partners. And really kind of the impact it has on the implant side of our practice. My name is Dr. Kyle Bogan. I am a general dentist practicing just outside of Columbus, Ohio. I started my journey with digital dentistry, including implants, about 10 or 11 years ago, and really kind of implemented various strategies to make this workflow pretty seamless in my practice. So I'm excited to share with you tonight kind of what this looks like from a high level and give you some details on workflow specifics. And so I want to start with a kind of a high level overview of implant case selection and planning before we get to the specifics of the workflow. Again, this isn't meant to be something that, covers every iteration of everything you'll find in your practice and as you're treatment planning implants, but I kind of want to give you a high level overview of things that I'm looking at. And the great thing about this workflow is it's a restoratively driven implant process. And so obviously there are things like systemic evaluation through initial radiographs, models, and photos. And we'll get into a little bit of the clinical evaluation in a minute. That's kind of where everything starts. So you have a patient, they are a candidate for implants or wanting implant treatment. And so from that systemic evaluation and initial radiographs, you go through a restorative treatment plan. From there is a digital impression along with a CBC cone beam 3D radiographic image. And I'll show you how all that works together to help in your case selection and planning. We won't get too much into implant site specifics, except when we're looking at case selection. But then there's, is the implant site ready? If it is ready, then we'll move into, choosing the implant system. If the site's not ready, do we treat it? Or at this point, do we refer it to one of our specialist partners? Which in my practice, again, being a general dentist, we treatment plan and we place a good amount of implants, but we still work with our oral surgery partners as well. But if the site's not ready, if you're going to treat it, you're going to develop the site or the surgeon's going to develop the site. And then once it's ready, we'll choose the implant system. We'll go through the specifics of surgical planning. There'll be a surgical template. We'll actually place the implant. There'll be a restorative phase and then ongoing maintenance. So I'm going to go into some detail on some of these today, but I wanted to give you this kind of high-level overview of the general process that I go through when I'm looking at case selection and planning in my practice. So like I said, we'll start a little bit and spend some time with the clinical evaluation piece. Because really, I feel like, especially depending on where you are in your implant journey, when I started placing implants, this was paramount to my success because, I picked the cases that I knew would be successful and didn't get into those cases that had some possible pitfalls until I was more experienced. So depending on where you are, you'll kind of see where you fall within the clinical evaluation and the comfort level of case selection. And so there are lots of things that we need to consider during the clinical evaluation piece. Extraoral things like soft tissue, TMJ, and muscles, intraoral things like soft tissue and hard tissue, specifically periodontal concerns like pocket depths, gingival recession, clinical attachment levels, or clinical attachment loss. Is there bleeding? Is the gingiva healthy? And this very important is the attached gingiva, especially if when you're looking at the decision, is it a punch surgery or are you going to lay a flap? And then obviously there are dental considerations too: occlusion, caries, restorations, and mobility. So all of these things will factor into our clinical evaluations as far as implant site selection. And so I break down my cases. I've heard this many different ways, but into kind of like the first level are the go cases. So these are people, if you're early in your implant journey, if you've got a healthy adult patient, these are all in your clinical evaluation. If you check all these boxes, these are pretty well, go cases and good cases to start with. Healthy adult patient, adequate space. And so in general, depending on the implant system that you pick, 7 millimeters of space mesiodistally, 7 millimeters of space buccolingually, and 7 or more millimeters of interarch space is a good place to start. If you have an edentulous ridge situation, that's a good place to start. If you're doing 1 to 3 teeth, posterior non-aesthetic location. If you don't have any grafting involved, either hard tissue or soft tissue grafting, again, a good place to start. If you have thick keratinized tissue and it's not a thin tissue biotype, that's a great place to start. And adequate bone, if you're not having to do any ridge augmentation or bony augmentation. These are all great cases for those people who are early on in their implant journey. Kind of caution cases, I'll call them. These are the ones to kind of really treatment plan carefully and consider depending on where you are in your implant journey again. But if you've got a narrow ridge, which would leave a low margin for error during surgery, if ridge augmentation or sinus augmentation is needed, direct or indirect augmentation, either one of those. If it's a thin keratinized tissue biotype, and then anterior cases that are more aesthetic in nature, again, are kind of those caution cases. What I call stop cases, which for my practice, these are the referral cases. There are some general dentists, obviously, that get comfortable with these as well. But if you're having to thread the needle with really low margin for error, immediate implants, I'm not doing those in my practice at this point. Soft tissue grafting is needed or high aesthetic needs. So again, those 3 levels kind of give you a good baseline as you start to look at case selection for implants you want to place. And then we're going to move on to the restorative treatment plan. And so again, like I said at the beginning, the great thing about using the technology and the workflow the way that we do is that instead of it being an implant-driven case like I've had to deal with so much in the past where the implant's placed where the bone is, and then we have to do the restorative calisthenics to make it look like a tooth. This workflow really lets us start from the crown down approach and put the restoration where it belongs and do the implant planning from there. So again, the crown down treatment planning, we're going to start by determining the final position of the crown. This is basically a digital wax up, and the final position is going to dictate the position of the osteotomy in the bone. And like I said, at this point, I'm going to skip through some of this diagram and move on to the implant system. And I'll come back to how the digital impression and the cone beam CT scan integrate in this workflow. But I want to talk just a second about implant systems. And I've used several implant systems throughout my implant journey. And I will tell you my favorite implant system at the moment is the EV system from Dentsply Sirona. It's a fully guided system, which I really like. And again, it's a site-specific crown-down approach. And the guided system with Astra EV really has all the components needed to help me have clinical success based on that crown-down approach. And so why guided? So obviously, lots of people place implants and they've placed implants for a long time, and they haven't always been guided. So what's the big deal with guided surgery? And so the great thing about guided surgery is that the picture on your left there shows the crown and the sleeve for the surgical guide and the placement of the implant. And the picture on the right shows that implant placed right where we had planned it. And so there's such a high level of accuracy with our surgical guides that it offers several benefits, kind of realistic benefits for my practice. One is decreased procedure time. So the surgical field is much smaller. The actual procedure time from a non-guided surgery to a guided surgery is significantly smaller, better for the patient, and obviously it fits into my day better. There's a decreased cost with guided surgery. We're not having to keep quite the inventory of implants that we would have had to in a non-guided practice, because we know pretty well the implant that we're going to be placing because we're planning that ahead of time. Efficiency is much greater, and there's greater accuracy of the final restoration. And from the patient's perspective, again, with a smaller surgical field, recovery is much quicker, less postoperative complications, less postoperative pain. And so from a patient perspective, they see the benefits of guided surgery as well. And then we can go into examples of implants that were placed unguided. And again, not that implants can't be placed in a great position without a guide. But as you can see in this example, the 2D image looks fairly well on the left side, but on the right side, you can see that implant was placed through the facial plate of bone, and the apex of the implant is not sitting in bone. Again, some other examples. The one on the left, obviously too close to the root. And, moving along, you can see that not great implant placement in these non-guided examples. We're also getting in my practice with the guided surgery. Patients love to see this stuff. And so as we're treatment planning, a lot of times I'm sitting in the chair right next to the patient, going through the planning process, dropping the implant in, as I'll show you. And they're getting to kind of take part in the discovery phase, and they're getting to see the technology and the workflow at work. And it's the precise nature of the guided surgery really helps reduce the stress on my staff and puts the patients at ease. So when we're looking at guides, guides have come a long way. And so all these guides are still available today. It used to be the classic guide was where everything went, and then the downside of the classic guide, while extremely accurate, it took 11 days to get the guide. We still use classic guides when necessary, but the majority of the guides that I'm using in practice are either Opti guides, digital guides, or CEREC Guide 2 or 3. With Astra EV, that's CEREC Guide 3 is really convenient. Opti guides take about 5 days. They're exported from the software. They are made over with CCAT over in Germany, and they're shipped to the practice. Digital guides are planned in the software, and they are milled at a milling center or printed in your office. And then CEREC Guide 3 can be a same-day guide, and they are milled in office. CEREC Guide 3s have sleeves specific for Astra EV. So we're going to walk through the surgical planning process with the software and everything at this point. And so, again, guided surgery with cone beam, digital impressioning, and surgical guides, and with CCAT can work with many different implant systems. The sky's the limit. I will tell you, I limit myself to a few, but most specifically, the Astra EV system is what we're using today. So the workflow overview at the highest level is you take an optical scan, full arch, upper and lower optical scan with a bite. You take a cone beam scan, and then you integrate those or stitch those together for your implant planning. And so what's great about the optical scan, and for those of you that have CEREC or Prime Scan, Omnicam, with the optical scan, you're taking the images you're designing the restoration, much like you were designing a crown for a patient. You're exporting that into CCAT, where the cone beam data is, and you're stitching those together to do your implant planning and guide fabrication. So I want to take some time to go through the software and kind of show you a demo of how that works, so you can see how easy and intuitive the workflow really is. So this video will start moving here in a second, but this is the cone beam data inside CCAT implant, and showing your panoramic view along with your 3D view. And up at the top, you have your CCAT suite up there. So CCAT implant is obviously what we're using, but obviously if you have other CCAT suites like Function Air, Endo, those are all available too. And then on the left-hand side, you have the panoramic view, and a lot of your implant plan will be done within the implant aligned tab there. And then you really just, it's as easy as it looks. You march from left to right across from prepare, plan, and treat. And so in the prepare tab, this is where you're importing your CEREC data. And so CCAT, if it's been data that's been in there in the past, it's available and ready to use. If it's new data, a new scan, you just import it. So you'll be clicking on the import button. And this is what it looks like when it comes in. You can see the blue tooth is the designed restoration. You click a few buttons and it is stitched on top of the CAD/CAM data. And so in the 3D view, you can see that the restoration is planned, and you can see the location in all of the cross-sectional views. And the next thing that you'll do, because it's a mandibular implant that we're looking at, is you'll trace the nerve. And so that's the process that's happening now. A few clicks inside the mandibular canal on both sides. And again, if you're only doing the one side, you can trace it on just the one side, but you are also able to trace both the right and left IAN canals. So there the nerves are traced. If we go to the plan stage, this is where we're choosing our implant. And so if you click that implant button, you click the tooth where you're placing the implant, then the manufacturer and implant line is a comprehensive catalog of pretty much every implant system, or at least the majority of them. And so for the EV implant system, we're picking the diameter and the length that we want. If you want to see the tie base in the schematic as well, you can turn that on. And again, you're seeing the implant in the CT scan in the cross-sectional views, and you can also look in the 3D view, and by turning off different filters, you can see various representations of what that looks like in 3D. And then once the implant is planned, software allows us to order the CCAT surgical guide, and then a report can also be exported to show you drilling protocols and all of that you'll need during surgery. This is where you select the guided surgery you want to do. So obviously EV guided surgery for fully guided. If you just want a pilot guide, you can select a CCAT pilot guide, and that can be, a guide can be fabricated just for the pilot drill, and then you can freehand the rest. But in my practice, we're doing EV guided surgery all the way. And then you can see the sleeve position in green there, so you can make sure there's no interference with the teeth that are adjacent. And then if for some reason you place the implant in the wrong position and it interacts with anatomy, whether it be a tooth or in this case, the nerve canal, you can see the red box. And so there's lots of fail safes built into this software, whereas as you're planning your surgeries, if something, if it sees a complication, the software will alert you to that so that you can adjust your plan. So like I talked about at the beginning, By combining the cone beam and the CAD/CAM data, we can plan the placement of the implant in a restoratively driven process, and we can place the implant with a guided technique. And now once, that has happened, we can do either chairside fabrication or we can do laboratory fabrication. So on the chairside fabrication side, CEREC Guide 3 is specifically for Astra EV implants. This is a great guide. Again, it can be milled or printed same day, depending on what software you have. I do believe for printing, we have the full lab. We have a Dentsply Sirona laboratory system in our practice, and so we have in-lab as well as chairside, but definitely can mill these chairside software. And then, if you're doing a punch with CEREC Guide 3, it's quick and easy placement. Again, appointment time in my practice, from the start of the osteotomy to the placement of the implant can be as little as 30 minutes, depending on the site. And again, the goal is, with whatever guide we're using, to go from a planned implant placement to the implant placed in the exact place that we wanted it to be placed. And the surgical guide controls the direction, the angulation, and the depth to precisely match what we had planned. So once the implant has healed and integrated, and again on the chairside side, we can restore it chairside as well. And so what that looks like is, since it's a properly placed implant, the restorative components become much easier. So the healing cap has been removed on the upper left. A scan post has been placed with a scan body on top. The CEREC scan was taken. It was planned with a tie base. And on the lower right, and that's a chairside fabricated implant restoration using a tie base. On the laboratory side, the planning software can be used also for fabricating surgical guides and restorations on the laboratory side if you're not wanting to do that chairside or in your office as well. The Azento workflow has been designed to simplify the process of working with the laboratory. Atlantis is a laboratory. They fabricate all sorts of restorations, and it is compatible with the CEREC workflow. And so I'm going to discuss kind of how Azento works. This is something that we've recently, within the last several months, really implemented in my practice. And what I can tell you about Azento is that it's pretty much implant surgery in a box. Everything that you could possibly need for that surgery is given to you. And the great part about this for my practice is simplicity. There's a lot of moving parts and pieces to implant surgery. A lot of inventory, keeping track of drills and implants, the guides. So this is everything all in one box. Is for single units, but it really has helped simplify things for my staff and my team to really make this process really simple. And so in this example, we've got the failing endo tooth that's going to be replaced with an implant. We're going to take a CEREC scan or a prime scan. We're going to send that off to Atlantis for the Azento workflow. We're going to upload the cone beam scan to Azento, and we're going to let them do their work. And so what you receive back from Azento is a treatment plan. So you log into the web portal. You see, much like you see with CCAT implant, the implant's placed. It's showing you everything. They've mapped the nerve. You make sure the placement is where you want it. If you want to make adjustments, it's as simple as making a note to Atlantis saying, I'd like it to be another millimeter in depth, subcrestally, whatever that looks like. You can also use the software and move it yourself if you want to. And so in my most recent case, I had a few corrections that I wanted the lab to make. So I made those comments. They sent back a treatment plan that I then approved. And then once that treatment plan was approved, they sent me this box. And I'll go back to this slide. And in this box is the model there that you see. In the model, you also have the surgical guide ready to go. Every drill that's needed in the drilling protocol will be included. You'll get a custom formed healing cap. And depending on what options you choose, you can also receive a Atlantis abutment as well as a temporary crown. So obviously, if you're doing anterior work, you're doing immediate implants, that is great to have. I'll tell you, a lot of times I'm just using the custom healing, custom tissue former, and the workflow is so precise and the placement is so precise for Azento, and I'll show you how that works in a minute, that sometimes I'm also ordering the Atlantis abutment to have down the road as well. But it's great. Everything's all in one place, all in one box, ready to go for surgery. So again, this is what the plan looks like when we get it back from Azento. And then this is showing the surgery process for the EV drilling protocol. The sleeves, there's no keys. It's a keyless system with the sleeves actually on the drill that fit into the surgical guide. And so as the implant's placed, the timing is very specific. It's a fully guided system. And the way that Azento is able to make a custom tissue former and for immediate cases give you a Atlantis abutment and a temporary crown that's pre-made is because the timing is controlled for depth and rotation of the implant. So they make sure with the notches on the implant carrier there that you can see the metal kind of horseshoe shaped notch, along with the notch in the surgical guide, that surgical timing is controlled for rotation and depth. And so it's critically important as we're doing EV guided surgery with the Azento system to make sure that those the timing is perfect so that all the components that are pre-made will fit that implant. And that's kind of the one critical piece that we have to watch out for with this specific workflow. So again, post-surgery, it was done with the punch, timing and everything was controlled. In this case, they placed an immediate provisional with an anterior immediate implant. And so the Atlantis abutment was placed along with the temporary crown and the sutures in place. And that's what the patient looked like post-surgery. 3 months post-op, that's what we're looking like. The x-ray shows the implant with the custom temporary abutment on there. And then at this point, if you are using the laboratory for the final crown and not doing that chairside, we'll scan that with the Cerex system, and this impression post is an Atlantis IO-Flow impression post. And by scanning it with this impression post, we can send it to Atlantis and have a custom abutment made. And so in my practice, the way this workflow works is we scan with the IO-Flow post, Atlantis, we ask them for the custom abutment, and we also ask them for a guide so that we're the transfer jig that helps align the custom abutment. The custom abutment's placed. It looks like this. So in the anterior, Atlantis has gold-plated titanium for aesthetics, and the posterior, obviously standard titanium. And the great part about Azento workflow and the tissue healing with the custom tissue former is we get great tissue architecture around our custom abutments. And as you can see, the final restoration looks very natural, starting from the crown down implant treatment planning through the guided surgery, through the custom tissue former and temporary provisionalization if needed, through the final impression to the final crown. And then as we come back to our final case selection and planning, I really want to take some time to talk about, the flexibility that this workflow gives you. So, lots of us are at different places in our in the technology that we employ in our practices. We're at different places with how comfortable we are with the implant process. And I would tell you, when I first started in the digital process, the digital dentistry workflow, it started out with Chairside CAD CAM. So it was Crown and Bridge and work Chairside with, at that point I had the OmniCam. And we, as it progressed, I was able to add things to my practice, as when I was ready for them, and it all integrated seamlessly in the workflow. And so it was great that our cone beam can talk to our prime scan. And, as we're comfortable fabricating things chairside, there's a process for that. And if I have a patient that I need a surgical guide now, I can make that chairside and we can go with it. If it's a case that, I don't have the time or capacity to do chairside and I want to have that done in a laboratory fashion, the Azento workflow has really come in handy in helping us with really maintaining inventory, keeping costs down, being more efficient. So there's just a lot of things that are great about the digital workflow. But it really starts with proper case selection. And so as you kind of march into more complex cases and you're staging treatment, you're doing ridge augmentation, you're doing sinus augmentation, the basics stay the same. You're just allowing more time for healing and things of that nature. But really the workflow has gone a long way in my practice for helping us make sure that patients are happy, the team is on board and knowing what to happen, and outcomes are pretty predictable. I want to make sure I left a lot of time for questions and answers because I know there's a lot to unpack here. And so if I stop sharing, maybe I can go back to my slides, and I hope there's lots of questions.
Perfect. Thanks, Dr. Bogan. Yeah, so if anyone has any questions, please type them into the box labeled "Have a Question" on your console. It should be located on the left side of your screen. So we'll give it a few minutes to see if anyone has any questions.
I'm really hoping there's a lot of folks out there excited about digital workflows.
Sure. Your presentation was so great. There's a lot of questions. We'll give it one more minute just because there is a delay sometimes by the time the questions get to us. Just want to make sure we don't miss anything. All right. I think this might wrap up. I don't see any questions coming in, but if anyone does have any questions, you can always email us at webinars@henryschein.com, and we'd be happy to work with Dr. Bogan to get those answered for you.
Yeah, any way I can assist anyone in implementing some digital workflows to make things more predictable and efficient, I'm all for it.
Great presentation. You did a really good job at kind of simplifying what a lot of people are concerned about or trying to figure out in terms of the workflow. It was good. It was easy to understand.
Yeah. Absolutely. It can be daunting when you're first trying to get into it. So it makes things much easier, although it can seem complex to begin with. Yeah.
Have you started looking at prime print? Sounds like you have in lab, so you're kind of halfway home.
Yeah, prime print's looking pretty good. I've got a printer that I'm using, but I've never seen a printer make things so kind of easy and less messy. That's prime print. Prime print's looking pretty amazing.
That's that old red Staples easy button. They've kind of just figured that out. It's like, all right.
It truly is. Speaking of making complicated, dirty processes simple and clean, they sure hit it out of the park with that one.
Yeah. Well, they're smart. I mean, and we saw it in your presentation. That's why it's very good about having the solution figured out. There's all the little things. Is there a lab that connects with the system that can help me out? They've got all the corners covered, that kind of really make it so that you can practice rather than, be a lab.
Yeah. Well, and the interesting part is if you're somebody that's not been in the digital space yet and you're wanting to do, CT guided implant surgery, it's a lot to bite off at once. And so the great thing about the reason I went with the Dentsply Sirona in the beginning is because I wasn't quite ready for that. And their systems all talk to each other. And so as I was wanting to add stuff in and now maybe prime print, it all integrates and talks to one another. It makes it so easy.
Yeah. Yeah. We see that too. If you poll all of your customers after they've made their purchases and look at the percentage of happy ones, for sure in the DS space, that the people that jumped in, plugged their nose and went are like, oh yeah, okay, this is great.
Yeah. Yeah. The worst thing that some of my colleagues and friends of mine that have differing systems and they can't get them to talk to one another, there's a level of frustration there that I don't have to deal with. Yeah.
Yeah. We get to play with all of them. And that's the first part of the consult is, an ecosystem or a Frankenstein. Which one are you looking for?
Yeah. Yeah. And in my practice, when we've got the lab equipment as well as the chairside equipment, everything talks and works well together.
Yeah. Great.
Awesome. Well, thank you, Dr. Bogan, for your time and expertise this evening. And thank you to Dentsply for sponsoring this webinar. And thank you all for attending. We are going to turn it over to Michael, our fast track advisor, shortly. But I just wanted to let you know that we did record tonight's webinar and we will email the recording out sometime in the next week. All right, Michael, I'll pass it on over to you.
Welcome. So I'm one of the technology advisors with Henry Schein, and our job is to kind of help in that journey that we've just been talking about in terms of moving into digital technology and workflows and helping with the equipment selections, making sure we get the right fit for the office and what your needs are. What I'm going to do is share just briefly. We're not going to take too deep of a dive. Kind of how that process starts and what it looks like, and hopefully give you guys some opportunity to talk to the local FTA that's in your region, that's Fast Track Advisor, really technology advisors, and connect with them. I think there's a box in the window where you can actually enter your zip code, and that will initiate a request that comes to us via email, and we'll reach back out to you and set up a time one-on-one where we can do sort of more of a private session. So guys, this is kind of like a PowerPoint, but it's an interactive presentation that we put together that kind of helps with determining what piece of equipment amongst all of these components really fits. Dr. Bogan did a really great job of talking about kind of what the steps are as you're pursuing engaging in digital workflow, digital technology for your practice. And there are a lot. I mean, radiology is a big piece. We talked about the cone beam during the presentation. An intraoral scanner is another important component in the digital workflow with implantology. And then what you do with that from this point, there's so many different options. It's one of the neat things about Dentsply is they've got all of the different parameters covered that allow you to kind of customize what works for you in your office. Big decisions typically become, do you do any of the design work in-house at your office, or do you send some of that design work out to a lab to partner with? And then once the designing step is completed, what do we do in terms of fabrication for some of the pieces that we're going to need? For example, the surgical guides. We can mill them, and now we can print them. Or the laboratory can do the same. So you can decide, do I do some of that in-house, or do I let the lab take over? So this road in your journey, there's multiple different directions that you can go on. So it's not a one-size-fits-all type process. Whatever really kind of works for you in your practice is where we guide you to. The important parts of it remain the same. If we're going to do implant workflow in the digital space, we utilize an intraoral scanner. We talked about steric prime scan, which is really it's the gold standard of intraoral scanners. We're fortunate to be able to work with just about everybody. And then the other component that you bring in as far as a piece of that technology is the extraoral imaging, the cone beam. And this is where it gets more in the weeds, in terms of what piece of equipment do we pick. There's several models that Dentsply has to be able to pick from. The major decision really kind of comes into field of view. How large of a field of view do you want to get in terms of what indication you're looking for? And we'll just talk through what your needs are, your plans for short-term, long-term, what's going to fit now, what's going to fit in 5 years. This is going to be a long-term investment. Make sure that we get you set up for the future, not just for the current. So the Axios is their largest field of view model, but you may or may not be looking for such a large field of view, depending on the indications that you're going to look at. So that's one of the main things we really spend some time digging into is what machine fits the needs for your office. And then the other big part of it is, what does the ecosystem look like? What is the machine going to do in terms of integrating with all of the other components in your office so that your workflow becomes easy? And that's something a lot of folks don't think about. But as you get really busy, engaged in digital workflows, the efficiencies that having a well thought out ecosystem create are really important. And earlier, Dr. Bogan and I were just chatting about the Frankenstein system versus the well thought out ecosystem. Dentsply pretty much has every corner and every aspect of how all of this digital technology works together figured out. And even having the lab support side of it as part of that workflow. Atlantis is a great resource as far as their whole ecosystem. They have a new piece of equipment coming out, Prime Print, which is a 3D printer. And that's going to diversify the opportunity as far as what you fabricate in terms of surgical guides. You can now mill them, or you could print them. So that's kind of, I really just wanted to give a basic overview of the pieces that are involved. And if there's questions that are coming up while I'm talking, pop them into box, or we'll take a couple of minutes afterwards and be able to have questions and answers. The biggest new piece of the pie is the 3D printing, and Prime Print is Dentsply's newest offering with printing. As they have with all of the other components that they brought to market, they took a lot of time thinking through how do they want this part to integrate. Because it's new and it's a little bit of a different workflow. It is the cleanest and easiest 3D printing system that is made right now. Very, very efficient. And the quality of the product that it produces is up to that same Dentsply Surrounda standard of very, very high quality. So it's a great printer, getting lots of looks right now. They're going to have a lot of discussions of how this works in the ecosystem, not only in your office, but also in a cloud-based type workflow. So there's some really neat things that Dentsply is working on to help you be more efficient, besides just taking the initial imaging, doing the planning, and outputting the product, to helping you in terms of partner with cloud-based solutions for that. So if you guys are interested in kind of going through this on a deeper dive, reach out to your Fast Track advisor, put your information in the zip code box, get that process started. We'll reach out to you and kind of get the whole thing started. So we just wanted to take this time to really go over how we can help you make good decisions and help you on your journey to digital workflow with implantology.
Thank you so much for that information. And again, thank you everyone for attending. We'll leave it open for a minute or two. If anyone does have any questions, you can type them in using the Have a Question box on the left-hand side. Also, just like Michael mentioned, if you would like to be connected to your Fast Track advisor, you can click on the schedule Today widget on the right side of your screen. So we'll leave it open for a minute or two.
Well, thanks for everybody hanging in there for a late night session.
I'm not sure if there will be any questions, but if there are, you can always schedule some time with your FTA, like I mentioned in the Schedule Today widget on the right side of your console. If you have a webinar-specific question, you can always email webinars@henryschein.com, and we'll be happy to help you. So thank you, everyone, for attending tonight's webinar and staying on late with us. We really appreciate it and hope that this was helpful. We would appreciate your feedback via our survey that will pop up on your screen shortly. Thank you all for joining us, and we look forward to seeing you on future webinars. Thanks again.
Thanks, Gran. Have a good evening.